Our research topic is Alzheimer's disease, also known as the senile dementia of the Alzheimer type, or quite simply AD. We chose this topic because it is a huge topic with a high growth rate of people being affected yearly. Alzheimer's disease is a fatal, progressive, and degenerative disease that destroys brain cells. It is the most common form of dementia, a general term for memory loss and other intellectual abilities serious enough to interfere with daily life. It was first described by a German psychiatrist and neuropathologist Alois Alzheimer in 1906 and was named after him. As the disease progresses, it spreads to parts of the brain that control walking, swallowing, and coordination. In this way, although Alzheimer's starts out as a problem with the memory and thought, it eventually affects the function of the entire body. It is important to note that the majority of Alzheimer's disease-related deaths are due to infections such as pneumonia. It is a brain disease where brain cells progressively degenerate. Just like the rest of our bodies, our brain changes as we age. Serious memory loss, confusion, and other major changes in the way our mind works may be a sign that brain cells are failing. As damage spreads, cells lose their ability to do their job and eventually die, causing irreversible changes in the brain. Early symptoms are difficulty remembering new learned information, forgetting recent events, names, places, and difficulty finding the right words. As it advances, it leads to increasingly severe symptoms such as disorientation, rapid unpredictable mood swings, difficulty performing familiar tasks, and difficulty speaking, swallowing, and walking. Scientists generally agree that there is unlikely to be a single clear cause of Alzheimer's, but extensive autopsy studies have revealed two phenomena: plaque buildups, which are protein buildups between brain tissues or nerve cells, and tangles, which are twisted strands. Both damage and kill brain cells. One of the known risk factors is heredity. Researchers know that having a close relative with AD increases a person's risk of developing the disease. It is likely that the causes include genetic, environmental, and lifestyle factors. It is not known exactly how Alzheimer's is passed on genetically. Alzheimer's disease results from an increase in the production or accumulation of a specific protein, beta-amyloid protein, in the brain that leads to nerve cell death. This is characterized by the loss of neurons and synapses in the cerebral cortex and certain subcortical regions. The brain controls all the other parts or organs of the body affected by Alzheimer's, such as the digestive system. The onset of pneumonia, which is a common cause of death to AD patients, is associated with swallowing difficulties that lead to accidental entry of food or liquids into the airways. Accounting for 64% of all dementias in Canada, it is predicted to affect 1 in 85 people globally by 2050. This year, nearly 36 million people have Alzheimer's or related dementia. Only 1 in 4 people have been diagnosed. Today, someone in the US develops AD every 67 seconds. Because the disease affects each individual differently, the symptoms, the order in which they appear, and the duration of each stage vary from person to person. In most cases, the disease progresses slowly and the symptoms of each stage may overlap, often making them move from one stage to another at a slow pace. Early and mild stages have a duration of about 2 to 4 years. Symptoms are frequent recent memory loss, repeated questions, some problems expressing and understanding language, difficulty in writing and using objects, depression and lack of interest, and needing reminders for daily activities. The moderate stages have a duration of about 2 to 10 years. Symptoms are speech rambling, unusual reasoning, confusion about current events, time and place, sleep disturbances, problem impacting mobility and coordination, recognizing family and friends, inability to learn new things, and difficulty carrying out tasks that involve multiple steps, such as getting dressed. The final stage is the severe stage, with a duration of 1 to 3 years. Symptoms are generally disabled with severe or total loss of verbal skills, cannot walk without great support, illness, extreme problems with mood, behavioral problems, and hallucinations. Patients need total support and care and often die from infections or pneumonia. There currently is no cure for Alzheimer's disease. However, several medications such as Aricept, Exenol, Remelin, and Nemada can be taken to slow the progression of the symptoms. The medications work differently for different patients, so it is important for a physician to monitor patients receiving. Advanced medical imaging with computed tomography, MRI, and with single photon emission computed tomography or positron emission tomography can be used to help exclude other subtypes of dementia. If everything else is ruled out, then the doctor will make the diagnosis of Alzheimer's disease. The older you get, the greater your chance of getting the disease. At age 80, a person has a 50% risk. Women tend to be more likely to get AD than men. Having any other form of mental disability, such as a person living with Down syndrome into their 40s, always develop AD. It is also inherited genetically. Persons living with Alzheimer's disease usually have an average of 8 to 10 years to live after their symptoms become noticeable to others. But survival can range from 4 to 20 years, depending on age and other health conditions. Often, the primary caregiver is a spouse or family member. Signs of caregiver stress include feeling tired, gaining or losing weight, losing interest in activities that were once enjoyed, or sleeping too much or too little. Caregivers are prone to risk for stress-related physical conditions such as heart disease and diabetes. They are the invisible victims of AD. We got our information from various websites such as alz.org, alzheimer.ca, nia.nih.gov, which is the National Institute on Aging. We hope with this, you now have a better view and understanding of Alzheimer's disease. Thank you for listening.